and welcome back to my YouTube channel. Again, my name is Ruth and I am your nutritionist. I have really missed you. If you have missed me so, then please stay with me until the end of this video. And if you love my content and you're new, then please make sure to subscribe, like, and then share. And if you've been there with me, then just like and share. So welcome to the world of nutrition. Today I'll be talking about blood clots, and that is the increase in the number of patients of blood clots, heart attack, different types of strokes, and different disorders that characterize metabolic syndrome, which are associated with abnormalities in blood clotting. This is high blood pressure, lipid abnormalities, diabetes mellitus, and obesity. Okay, so I want you to understand that blood clot is the formation of plaque in the inner walls of a blood vessel, and this blocks blood flow. Some types of plaque rupture, okay, and these are the ones that cause blood clots. Okay, so we all know that the blood cell platelets helps in blood clotting. They sense when a place has been damaged in your body, and then they cramp around that area, okay, and they form a blood clot and they will stop bleeding. Okay, this is where blood clot is very beneficial to us. But as much as it is beneficial, there are many blood clotting abnormalities which are potentially fatal and they can cost you life. Okay, so one abnormality is through atherosclerosis. Okay, atherosclerosis is when the arteries become progressively thickened. Okay, like if this is the size of your arteries, and then they become progressively thickened, and then the size continues contracting until now you have atherosclerosis, very thin size, and this leads to high blood pressure, and this is now atherosclerosis. Okay, and this narrowing is due to plaque, and plaque is a lipid containing material. Okay, it contains fibrous connective tissues, it contains the smooth muscle cells, it contains the fatty deposits. Okay, and let's say if this is your artery and then there is a branch somewhere here, so as blood is flowing, there is disturbed flow at the branching. Okay, and this causes some type of stubble damage, and this damage now will elicit an inflammatory response, and this inflammatory response attracts immune cells and increases the permeability of the artery walls. And after the permeability of the artery walls has been increased, the low density lipoproteins, these are the proteins which are responsible for transportation of cholesterol. Okay, so they carry cholesterol from all over the body, the excess one which wasn't used by the cells throughout the body, they take it back to the liver where it is stored, or maybe for different uses. Okay, so this low density sleeps under the endothelial cell. The endothelial cell is a thin cell layer that is on the artery walls. Okay, and it is of the artery wall. So the low density lipoprotein sleeps under that endothelial layer, endothelial cell, and then it becomes oxidized by the local enzymes there. Okay, and when it becomes oxidized, the body senses a foreign thing. Okay, so the artery walls will send its immune cells. The immune cells will come and then engulf, like go around that foreign material, fight the foreign material. Okay, it will engulf the whole thing. Okay, and then it becomes a foam cell. Okay, this foam cell is a fat laden cell, and so this plaque continues accumulating. Okay, that is the process how plaque is formed. So this plaque continues accumulating. The foam cell is the plaque now. Okay, so the layers continues accumulating. As the layers continue accumulating, it continues narrowing, and now you have atherosclerosis. Some types of plaque can rupture, and when it ruptures, it moves into the bloodstream. When it gets into the bloodstream, and now you have atherosclerosis. So if the plaque that has ruptured is in different cells, so probably it is bigger than the size that has remained after you've have had atherosclerosis progressively. That is to say, slowly and continuously. If the plaque starts forming when you are a child, you will realize that you will realize that probably you might be having atherosclerosis, or you might be on the way to having atherosclerosis when you are already an adult. Okay, so if you do good food, like good nutrition, that is most fruits and vegetables, and then low fat foods, avoid a lot of fried foods, you might avoid this atherosclerosis problem and plaque that comes about with atherosclerosis that bring about blood clotting. You see, so if this plaque is too big, it is going to obviously block blood flow, and when it blocks the blood flow, that means blood won't flow further, and the muscles around the area that the artery was supplying blood to will obviously become dead. Okay, so that is how blood clots come about through atherosclerosis. Number two, abnormalities of blood clots bring about deep vein blood clotting. These are the blood clots that usually form in the legs. Okay, and these blood clots are actually stationary, they don't move, and they are potentially fatal because they cause inflammation, swelling, and pain. Okay, number three is the estrogen hormone replacement therapy. Okay, also increases the tendencies of getting abnormal blood clots. Okay, diabetes mellitus. Through various mechanisms, diabetes mellitus increases the tendencies for vasoconstriction. This is the process by which blood vessels, this is when blood vessels narrow. Okay, vasoconstriction, narrowing of the blood vessels, rupturing of the plaque, rupturing of the plaque, and of course blood clotting, abnormal blood clotting. Okay, and alcohol. Okay, as much as alcohol helps prevent blood vessel dysfunction, I want to say that too much intakes of blood alcohol, let's say excessive intakes of alcohol, elicits the inflammatory response. Okay, and this of course is the process by which that plaque is formed, and when that plaque is formed, of course it increases that it is going to promote the abnormal blood clotting. Okay, yeah, so the disorders that characterize metabolic syndrome, that is like obesity, high blood pressure, and lipid abnormalities also are associated with the process by which abnormal blood clotting occur. Okay, there is this inflammatory response, the inflammatory response that attracts the immune cells and increases the permeability of the blood vessels at the area that has been damaged or injured, that elicited this inflammatory response. Okay, and this helps blood clotting. Okay, it helps in blood clotting, but the problem is if this inflammatory response is prolonged or continues for a very long time, it will cause fatal problems that can cost you life. And then, so let's say in case you monitor something different, like an inflammatory response that is a little bit abnormal, it is okay to visit your doctor. Okay, yeah, but this inflammatory response, okay, because it brings about the immune cells, it promotes healing, okay, and prevents further damage. Okay, and these blood clots, okay, they like prevent excessive bleeding that can bring about anemia or maybe even death. Okay, so I want you to understand that 13 different types of proteins are 13 different types of proteins and calcium are involved in blood clotting, and vitamin K is responsible for activating several types of these proteins, and these proteins are actually synthesized in the liver, and in case any factor is not present, an hemorrhagic disease might occur, and that is a disease whereby if a blood vessel is damaged in your body, the bleeding might go unnoticed by the body. Okay, the mechanism of blood clotting to stop bleeding might not take place. Okay, yeah. So let's go to the consequences of blood clotting, abnormal blood clotting. So when a blood vessel supplying blood to your brain, that is an artery that supplies blood to your brain, has been blocked by a blood clot, you will suffer a stroke called ischemic stroke. Okay, and this is of course fatal. It is not okay. It is not a good stroke. It is not okay. It is not good to have a stroke generally. And then if your coronary artery is blocked by a blood clot, probably the atherosclerotic plaque blood clot. Okay, probably you're going to have a heart attack. Okay, when an artery supplying blood to a part of muscle has been blocked by a blood clot, that part of the muscle dies. Okay, and that is not of course good, because the muscles need to work for your body to be flexible, and like, okay, there are many functions of your muscle. And guys with nephrotic syndrome have a very low density there low density lipoproteins. There are very low density lipoproteins, and there are lipoprotein A, which are responsible for clearing cholesterol from the all parts of the body to the liver. Their levels have been altered. Furthermore, blood clotting risk is increased due to the protein losses in their urine, and these proteins are the ones that inhibit blood, which these protein losses inhibit blood clotting, because even the plasma levels of these proteins, which are responsible for blood clotting, has been altered. Okay, yeah. And the blood clotting abnormalities increase the clotting that form in the deep vein. Okay, that deep vein blood clotting increased by blood clotting abnormalities. So let's go to the interactions. If you're taking vitamin E supplements, it means you might have vitamin E toxicity, and vitamin E toxicity alters the function of vitamin K, and vitamin K is the one that activates several proteins which are involved in blood clotting. Okay, and alcohol has, okay, let me say that in excessive ingestion of alcohol brings about liver problems. Okay, and liver is the one that synthesizes the proteins which are involved in a blood clotting. Okay, and if you can remember very well, if any factor involved in blood clotting is missing, then you're going to have issues. Okay, you're going to suffer some hemorrhagic disease. That is, bleeding might go unnoticed by the body. So some type of mechanism to prevent this bleeding is not going to occur, to take place. Yeah. Okay. So I want you to understand that there is this anticoagulant, okay, and its name is warfarin. Okay, and warfarin's action has a very important interaction that you should know, of course, and this interaction is with vitamin K, and it is because vitamin K is structurally the same as this drug warfarin, which works to block the enzyme which works to activate this vitamin K. Okay, so inhibiting blood clotting. Okay, yeah. That is, this warfarin, okay, is an anticoagulant medication, and anticoagulant medications are the ones that correct abnormal blood clotting. I hope it's clear now. Okay, yeah. So let's go to how you can prevent blood clotting. One thing is exercise, at least 150 minutes a week. So that is like 30 minutes in 5 days in a week. Take enough water so that your blood is kept always diluted. Okay, yeah. that is like at least 8 glasses in a day, but if you can take more, but not too much. Yeah. And appreciate whole grains, appreciate legumes, appreciate appreciate fresh foods. This is the vegetables, the fruits, okay? Yeah. Appreciate low fat foods, okay? Fats, appreciate the non-saturated fats, okay? That is to say, avoid saturated fats, okay? Try the polyunsaturated fatty acids, that is the EPA and the DHA, and take the omega-3 and the essential fatty acids, that is the linolenic acid and the linoleic acid from, of course you can find this from fish, and the eicosanoids, that is the 20 carbon that is found in the fatty acids, okay? Yeah, that is the simple way how you can prevent these abnormal blood clotting. But the good thing is you have nutritionists out there. There are many of them. I have also offered myself to be your nutritionist, and I hope I am your preferred one. And they are going to help you to get proper details in how you can do this for those who have had this for those who are trying to fight these blood clots, and for those who have had some medical history to do with these blood clots, or for those guys who are trying to fight some disorders that are associated with these abnormal blood clot formations, or what, or yeah, or someone who just do not want any blood clot that maybe might be coming about maybe through atherosclerosis, okay? Your nutritionist is going to be of much help here, and they are going to really help you have a good health and prolong your life. So thank you for staying with me until the end of this video. I love you so much. Bye.